a whole different world in corrections now. You can't just take them to jail, lock them up. You got to assess them. You got to meet their needs.
Mental health has been here a long time. No one has addressed it. They know about it, but it's never been addressed in this manner.
Problems that people have in the mental health field runs a wide variety, from substance abuse to psychosis to medication issues. It's just a wide variety. I mean, we see everything. For the last couple, 3 years, we've had a crisis worker on site that we were paying for, and we just recently received a grant, and now we have a full-time person on.
And I sit and book, and when a young lady or male comes into the booking area, what I'll do is let them get booked in, and then from there I'll let one of the deputies know that I want to speak with that person. And with that, I start off asking a series of questions that comes from our Ohio risk assessment. Also with those that come in that may have already had a history with us, we can reestablish that history.
What I like to think is our continuity of care. When somebody's released from here, they're going out of here with the knowledge of knowing where to go to get follow-up care. If it is a medication issue, we're giving them that medication to continue that care and sending them to the right place to be able to get the medication they need. If we've made appointments for them, giving them the dates and the times of those appointments, making sure we go over that, make sure they can make those.
When we provide that service, they have that opportunity to say, hey, I really want to help myself. And you get a lot of them that are truly looking at getting themselves back together and getting themselves where they're able to get their children back if they're in custody of the state, whether they're trying to reconnect back with their families or their just some loved one, or just being able to adapt in a society where they're not having to use drugs or alcohol. And when they're found out that there is a service and there's someone willing to help them, that they do have a chance, and that's the great thing about that.
If you just turn them out the door, I mean, they're going to be right back in the door. They're just going to be on the street. They're going to be homeless. We try to set up a community here that's not just here to, you're locked up, do what we say. We try to assess and recognize those needs, and then we try to reach out and get them the service they need, and then we make sure that we give them the continuity to continue that care once they leave here.